Sports concussions may grab the headlines, but many athletes feel the effects of a violent collision below the helmet, suffering catastrophic spinal cord injuries.
Usually what happens is you suffer an injury to the bones and the ligaments of the spine, and once the spinal cord has been injured, then that person may never ever have that function back again.
80% of spinal cord injuries happen to males, mostly between 16 and 30 years old. 9% result from sports.
Injuries can be suffered from direct compression, from torsion, twisting, flexion, extension.
Dr. Robert O'Connor is with Lee Memorial Hospital's Trauma Center.
They can happen on the soccer field from hitting a ball the wrong way. They can happen from two people colliding. In our community where we see them a lot.
In the best cases, symptoms will be temporary.
Frequently, patients will have what's called stingers, especially basically where they have a transient episode where they have burning pain or partial paralysis sometimes that lasts for a brief period of time and then they regain function.
The spinal cord is about 18 inches long, running from the neck to the pelvis. Generally, the higher the injury, the more severe. While a severed or complete spinal cord injury offers little hope of regaining movement, a partially damaged spine has a better prognosis.
If they have an incomplete injury, as in there is some preserved function of strength or sensation, usually once we decompress the spinal cord, they'll regain some of that. We really won't know for sometimes up to a year how much of it they'll get back.
Symptoms of a spinal cord injury include loss of function below the level of injury. Patients may have extreme pain in the neck, head, or back, tingling or numbness in the extremities, loss of balance, or impaired breathing.
A 17 to 25-year-old football player who suddenly loses function is a terrible shock, especially with somebody who doesn't have any pre-existing injury or malformation of their spine.
Any on-field injury should be given maximum attention. For Lee Memorial Health System, I'm Amy Osher.